Thank you very much, Mr. Chairman. You know, we've heard a lot about wanting to do studies on harm. The fact is that nearly 100% of abortions actually lead to death of a child. Not to mention, we know for a fact that there's been hundreds of women who have died as a result of botched abortions. However, that number is grossly underrepresented, as states with some of the highest abortion rates, for example, California, they don't even report those numbers. But let's see what some of the centers that my colleagues on the left actually support. For example, Planned Parenthood. They argue that we need to fund Planned Parenthood because it gives women resources to have actually health care. Well, the fact is that total services are down from Planned Parenthood by 17%. With changing practice guidelines, total cancer screening and prevention services have dropped by 71%, including declines of 74% for breast exams and 70% for Pap tests. Prenatal services are down 85%, and contraceptive services are down 97%. The fact is that what Planned Parenthood does provide is 97.2% of their services are abortions. So when we think about where are women going to get their actual health care, we are taking an opportunity and a resource away from them. On the flip side, from what Planned Parenthood offers, we've got pregnancy centers and what they offer. 82% of them have access to ultrasound. Parenting and education classes make up almost 88%. 72% after abortion support and recovery. So these are women who've had abortions who can then seek help from these centers. They have maternal items, 90%. STD screenings at 36%. STD screenings of treatment at 28%. Lactation and breastfeeding consultant. For 27% of the centers have those. Fertility awareness methods, 11.45%. And the list goes on and on of the services that are provided by these centers. So the idea that we are somehow not getting health care to women, you want to take this resource away from them. And I've heard from my colleagues that, well, these resources really aren't voluntary, and that people who go there feel pressured. They feel like they're forced to do this. The fact is, PRCs have some of the highest satisfaction rates around. Of the 16 million client sessions that took place in 2022, 97% of clients self-reported a positive experience. These numbers speak to why 91% of Americans support pregnancy centers. These women who voluntarily seek help are getting that. These women don't feel deceived. They don't feel forced. And then we hear that, oh, well, they don't have any access to real healthcare professionals. PRCs have a high standard of care. And most PRCs affiliate with a national network, most prominent being CareNet, Heartbeat International, and National Institute of Family and Life Advocates. So if we're going to talk about this issue, at least be honest. Thank you, Chairman, and I yield back.